Thank you so much for allowing me to be here tonight. So I think this is a topic that, while I'll present some information on it, I think we'll get the most out of your questions and our discussions about it. So I'm just going to present briefly about some of the background on this topic, and then we'll get more into your questions and discussion. So the first thing to really understand is that there is no right way to cope with cancer. So the child may express sadness or grief dealing with the loss of a healthy parent or a healthy household. They may express fear that their world is falling apart. They're afraid that their parent might die. I'm afraid someone else in the family might get cancer. I'm afraid something will happen to my parent at home and I just won't know what to do. They can also express guilt. So I'm healthy and my parent is sick. I can laugh and have fun, and my parent can't as easily. They can express anger. In younger children, this is usually more because there's a change in routine or a change in terms of how often the parent is able to physically be there for them. And with older children, it can be a little bit more complicated than that. There can be anger at the medical team for the diagnosis. There can be anger at God for allowing this to happen. There can be anger at themselves for their own reactions to the situation. They can have feelings of neglect, so feeling left out, feeling like they're not getting as much attention as they used to, not knowing what's going on or really receiving updates. They can feel lonely and like no one understands truly what they're going through, least of all their friends, and they can feel kind of isolated. Maybe friends aren't coming over as much anymore, or friends simply just don't know what to say to them. They can also feel embarrassed about how to answer people's questions, or maybe even going out in public with their sick parent and having to deal with potentially people staring at them if there are any physical sequelae of their treatment. So most children do not experience a significant psychological difficulty when their parent is faced with a cancer diagnosis, but some children are at increased risk for what we would call more internalizing symptoms. So these symptoms include depressed or anxious mood. It can be things like over sadness, worries, constant worries about the family member's health, persistent worries about bringing home an infection to the parent, those types of things, and also worrying about upsetting the family with questions about cancer and treatment. We also know that these worries can lead to poor concentration, can lead to intrusive or unwanted thoughts or unpleasant ideas, and this can result in some difficulties in school, such as lower grades. There can also be some disruptive sleep. And sometimes we also see some somatic complaints, which would be things like headaches, stomach aches, things that are not necessarily related to a real underlying medical condition. And finally, research has shown that children tend to cope better when parents are feeling better. So you might see that when a parent is feeling the acute effects of a surgery or chemo or radiation, then their child is also feeling worse. But when they start to feel a little bit better, maybe when counts start to return, that tends to be when kids feel a little bit better too. And I think it's also important to keep in mind that not all outcomes are negative ones. There can also be a lot of benefits, which is hard to think about when you're faced with a cancer diagnosis, but there is a whole area of research in benefit finding in cancer. So we know that in many situations, cancer can actually strengthen the parent-child and really the whole family relationship structure, because there's more of a focus on what's important and less of a focus on petty squabbles. We also know that kids can grow in maturity over this process and learning how to care for others and making them more prepared for adult life by increasing their responsibilities in these areas. And studies have shown that children who themselves go through a serious illness or have a family member that go through a serious illness tend to be higher on things like empathy than their peers, and this is a skill set and a quality about them that will serve them well later in life. Going through this test can also strengthen a child's spiritual connection, just as it can in adults. And we also know that kids can be more tolerant of change and uncertainty, having to deal with all the things that you have to deal with going through cancer treatment. And this can teach them to be more flexible over time. They can also have some enhanced self-esteem, particularly if they have more of an active role in helping out at home or helping out with the parent in an appropriate way. This can help them to feel like they're important and that they have a very definite and important role. And kids also learn, just as adults do, really who their true friends are through this process, and that can also be helpful. And then finally, going through this tremendous stressor can really help them to hone in on what coping strategies work for them. And then using these coping strategies can be helpful in terms of future stressors that they might encounter in life.